Okay, so we're going to talk about this week the chronic pain epidemic, and the topic of the week is the brain to blame? He put that together. Okay.
It rhymes.
It rhymes. It's very, we're getting cool now. Okay. No, really, the chronic pain epidemic, in all seriousness, is the brain to blame. Okay, and if it ain't the whole problem, it is a humongous part of the problem. Okay, so I'm Dr. Martin Rutherford. I'm a chiropractor, which actually may be pertinent to this particular discussion that we're going to have. I'm also a certified functional medicine doctor, and you
practitioner. And I'm Dr. Randall Gates. I'm a board certified chiropractic neurologist, as well as being a chiropractor.
So we are going to talk a lot about the topic that would be most appropriate to a board certified functional neurologist today, chiropractic neurologist. And we have a chronic pain practice, and we are both chiropractors. We actually have two other chiropractors who work with us, who have some kind of, well, we can't say specialties, but they have uniquenesses. One chiropractor does a lot of work with discs and post-surgical discs. We're going to talk a little bit about pain today. Knees, does a lot of work with knees. Others do spinal trauma. Dr. Kettering does a lot of spinal trauma. In other words, like car accidents, okay, whiplash, things of that nature, which is a unique area in unto itself. But we're going to touch on some of those things. And I made that issue because a lot of times when people come into me, I'm doing the intakes, and people are like, well, you're a chiropractor, and we don't want to be doing any chiropractic stuff. And the interesting part is, despite the fact that we are functional medicine doctors, which that's a whole other topic that I don't want to get into right now, and functional neurologists, I think really the chiropractic profession was the one who was in position to develop these. And indeed, Dr. Carrick, who developed functional neurology as a chiropractor, Dr. Karazian, who was one of the big promoters of ultimately of functional medicine, was a chiropractor, because we had a pretty good background in diagnosis, and we kind of understand the 600 and some muscles of the body, the 200 and some bones of the body. But I was taught neurology by one like a very, very well-known neurologist at the time, who went on to become a medical doctor and author books. And Dr. Gates is, I can't say specialty, what would you call it? Your discipline, your postgraduate discipline of how many hours is specifically in neurology, because in the end, even something as seemingly simple as manipulation affects neurology. And we were developing some concepts of chronic pain as chiropractors relative to car accidents, and relative to why does somebody get in a car accident and suddenly develop fibromyalgia? Why does somebody hurt their back and all of a sudden develop peripheral neuropathy? I mean, those were things that we couldn't understand. We're going to talk a little bit about that today. Maybe we're going to talk a lot about that today. I'm going to be kind of winging it today, because this is not my area. This is Dr. Gates's area. And although there's aspects of chemistry that we're going to allude to, this is going to be primarily about the brain, because we have said before, and I say to patients coming in here, if you have chronic problems, if you have a chronic gut problem, you have a chronic knee problem, you have reflex sympathetic dystrophy, and they tell you it's not ever going to go away, you have almost any chronic condition that's trying to get better. We just wrote an article not long ago that says, if you have chronic pain and it ain't getting better, you better look to the brain. And we're going to kind of, we're going to kind of go over that today. Sure. Did I summate that properly? Because you kind of threw this one on me at the last second, and that's okay, because this is really a pertinent, topic for the exploding chronic pain area, and the fact that, as I'm listening to the radios, I listen to the radio every morning while I'm getting ready to try to keep up with like what's going on and what's happening out there. It's kind of a radio program that gives a lot of data, and the brain has now become, Dr. Gupta is talking about it more. The local Alzheimer's groups are putting commercials on television talking about stuff that, with all due respect, it doesn't sound like they're totally conversant with, but they're talking a little bit more about the brain. Don't smoke anything that decreases oxygen to the brain. Alcohol, It's a little bit more than that is where I'm going with this, okay? And these are the things that they're hearing about out here. So we're going to bring a lot of this into focus today. Dr. Gates is going to bring a lot of this into focus today. I'll probably direct the conversation a little bit here, but in the end, we're going to be talking about chronic pain epidemic in our current approach. We're going to be talking about, well, I'm going to let you do this because you have a different idea, because you say tissue levels of treatment. You're talking about knees and backs and things of that nature. So I'll let you articulate the bullet points today.
So
bring a little more
bullet
clarity
points
to
are,
it than I would.
With the chronic pain epidemic, we've referenced it in other broadcasts. In essence, now the new number is 130 million Americans have chronic pain. That's about half the adult population. It used to be 45 million, then it became 70 million, then it became 118 million. 130 million individuals is an astounding number. So we'll talk about that. We're going to talk about the current model of treating chronic pain, which includes, it's basically tissue level treatments. Everybody thinks there's something wrong with the part of the body that is involved with pain. And sometimes there is, absolutely.
Right.
But if that was the sole cause of the problem, we wouldn't have 130 million chronic pain patients, because we could do a surgery, we could give a specific medication, we could inject cortisone and the pain would go away.
Manipulation,
physical therapy.
It's funny you're bringing this up, because I was thinking about this the other day, because I had a patient who was really hammering me on this. I said, well, look, acupuncture has been in the United States since 1972. Chiropractic's been around forever. Physical therapy has been around forever. Massage therapy has been around forever. All of it has a value. But we've gone from 45 million to 130 million chronic pain patients. So we're missing something. There's some other solution, or there's something else exactly that's being missed. And you're about to hear what a big part of it is today, I think.
Exactly. And that big part is the brain. And we're going to talk about specifically how the brain is involved with chronic pain, because every chronic pain sufferer needs to get this. And then we'll go into potential solutions for this problem.
Okay.
So the overview of our evolution is that, which, really Dr. Rutherford can tie in better, is that Dr. Rutherford was treating chronic pain patients since 1979. The thing that is great about Dr. Rutherford is that he was not just falling into what everybody else was doing. So that was a period in time when chiropractors could adjust, a gazillion people a day, and they could, do a gazillion therapies on an individual. And basically the profit margins were extremely high. And so a lot of doctors fell into that trap. Dr. Rutherford deviated from that, and he did everything he could to create individualized treatment programs for the problem involved. And the impetus was to get the person better, not just to rack up the biggest bill with the insurance company.
Wow. Peter would say that was very bold. I'm not sure I'm comfortable, but
well, I'm saying
it is true.
Anybody wants to argue with that statement?
Wow.
Let's go.
I didn't expect this.
But anyways, so that's where he was at. And then he got into scoliosis, and he got into other forms. He was always seeking a better way to handle the chronic pain problem. And then along came functional medicine, which we have done broadcasts on. We don't like the term. Functional medicine has now seemed to spiral out of control.
Starting to morph away from the term, but I am a certified functional medicine practitioner at the moment.
But the bottom line of functional medicine is using natural, non-drug based approaches for these chronic problems. And in 2008 and 2009, we were laughed at, and now we are semi-glorified for everything we've done in functional medicine, because the whole landscape has shifted such that when you told someone to get on a gluten-free diet in 2008, they just questioned you and said they had to talk to their doctor about it. And now everybody's going gluten-free. 100 million Americans last year went gluten-free. So the tide has shifted. But with all that being said, we are in the ground for functional medicine. We have really understood how, changing someone's diet can affect their pain levels, how putting someone on a certain supplement can affect their rheumatoid arthritis.
You have an MS patient who has just basically been on the diet for a week, and he's able to lift his legs better.
There you go. There's an example. And that is amazing. But by the same token, now everybody's getting really focused on that aspect of healthcare. They're getting focused on the diet. They're getting focused on what supplements can I take.
Which is good.
Which is awesome. But then again, everybody's forgetting the central component to the problem, which is the brain.
And those folks are still showing up in our office, even though you're doing a good job out there and you're doing the gut, and you're giving them the paleo diet, or you're giving them the autoimmune diet for whatever, or you're giving them this diet, and they're getting improvement, and you're giving them the supplements that you learned maybe in the functional medicine class or whatever, or off of your adrenal stress or whatever. Those people are still showing up in here. They feel good, okay, and then they don't feel good. And then it goes backwards because of what you're about to say.
Exactly, because no one is really paying attention to the brain and its involvement with chronic pain, chronic conditions.
Other than putting them on a biofeedback machine.
Biofeedback, I mean, we could go into a number of examples, but let's use... I wasn't mean to...
I'll stop talking.
No, I wasn't mean to. We're always trying to be diplomatic. We're not trying to slam anybody else, per se.
I'm sure I go through this every day, so...
Right, exactly.
So sometimes I have to share that.
So relative to this chronic pain, let's use fibromyalgia as an example, which Dr. Rutherford talked about extensively. He suffered with it. That was also an impetus for getting into this functional medicine arena. We know now with fibromyalgia that there are a number of things that are wrong. Fibromyalgia patients can have gluten sensitivities. Fibromyalgia patients lots of times have autoimmune responses to their thyroid, which creates inflammation in their body and can cause them to feel pain. A lot of them have been through childhood trauma. A lot of them have small fiber peripheral neuropathy, where their peripheral nerves are dying and degenerating. And a huge proportion of them have pain nerve receptor problems, like 80% of fibromyalgia patients. So there are things that are wrong in the periphery of a fibromyalgia patient. We worked with a lot of fibromyalgia patients. By changing their diets, you can help them. But as Dr. Rutherford said, lots of times those changes are all but temporary because you're not correcting the central problem. So what we're now seeing with fibromyalgia patients is that their brains, let me say it this way. So within our brain, we feel pain. We have many different parts of our brain that do different things. We see things from the back part of our brain. We think from the front part of our brain. We move kind of from the middle front part of our brain, and we feel things kind of in the back to center region of the brain called the parietal lobes. Was that simple enough?
No, I'll sum it later. for those of you who are not neurology fans.
So in essence, kind of right here is where you feel things.
Yeah.
And in that region of your brain, what we're seeing in chronic pain patients is that that area can reorganize itself. So think of a housing tract. And in a housing tract, we know who lives in which house. And you have that same example in your sensory area of your brain, such that right here encodes one area of your body on the left-hand side of your body. And right over here encodes another area of your body on the left-hand side. And what can happen with these chronic pain conditions is that the little housing tract real estate area can get reorganized such that you may hit your arm and you actually have pain in your elbow, as an example, with chronic pain conditions. And they're seeing now that this is rather prevalent. It's a big issue. And then also, when we experience pain with a chronic pain sufferer, different areas of the brain light up than someone who doesn't have chronic pain. So really the emotional areas start to get intertwined with the dysregulated sensory area of the brain. Go ahead and interject.
I'm not.
No. I think that's a good.
No. So you're saying that if somebody hits pain here, somebody gets pain here, it registers in the brain, and that part of the brain starts to kind of learn pain.
Exactly. And we now know that it's happening almost immediately. We used to think it took like months or weeks for the brain to start remapping itself. That's what it's actually called.
So in the fibromyalgia patient, a lot of different parts of their brain are learning pain.
Mm-hmm.
And then if I understand this correctly, your brain has this mechanism to shut pain down.
Mm-hmm.
Like it's the way Dr. Gates explained to me at one point in time. If we didn't have this mechanism, we wouldn't be able to put our socks on because we'd have so much pain just putting our socks on. But because you're getting so much of this input and your brain's learning so much pain, it loses its ability to shut the pain off.
Exactly.
Okay, that's what he just said.
Exactly.
And I think an interesting thing to go back to is when we started doing this, I was actually giving lectures on fibromyalgia, and we talked about the brain, but not like that. We didn't know that.
Right.
And most people still think, a lot of people still think that a lot of people still don't know what fibromyalgia is. They kind of know that the doctor's starting to accept it, but fibromyalgia means pain in the muscle fibers. It is nerve pain. And there's more to it than what he just said, and he's going to tell you about that. Okay, but yeah, that's what happens. That's what happens. Your brain is losing its ability to shut the pain off. Your brain's being, all these little nerve fibers are making parts of your brain learn that pain, and then we get enough parts of the brain to learn the pain. This is way simplistic, okay? But when you get these brains, the parietal lobe learn all those parts of the brain, it loses its ability to shut the pain off. And now you hurt everywhere all the time. Mm-hmm. That's what's happening. He'll tell you why.
Exactly.
He'll tell you more than that.
And so the classic example is the phantom limb pain sufferer. So they did studies on guys coming out of World War II and Vietnam where they lost an arm and all of a sudden they still felt the arm. And in fact, what they felt in that arm that was no longer there was incredible pain. And neuroscientists went in, they started doing research on these individuals and they labeled it remapping of referred sensations. So in essence, what happens is within this area of our brain called the parietal lobe, which is our sensory area of the brain, we have representations for our hands, for our face, for our lower back, for many different parts of our body. And these representations are well needed. So like 50% of your parietal lobe in your brain is for your hands and your face. Huge areas. For example, with people who are pianists, their hand representation in the brain actually enlarges because each area of the brain is like in a, let me say it this way, the body representations within the parietal lobe are like in a tug of war with each other. So if you use the hands a lot, the hands are going to overtake neighboring regions within this parietal lobe. But then if you lose an arm, then adjacent regions to the arm and the brain are going to grow back in. Does that make sense?
To me.
Okay, hopefully that makes sense to you. That's as simplistic as we can possibly put it there.
Well, you know what? This one we should have had a picture for. Basically, you have a huge part of your brain is used to do this because we are our hands, in case you haven't noticed, okay? You use your hands a lot. A huge part of our brain is used for this, for your face. So I mean like a humongous amount of your brain cells compared to all of the other cells you have are used for that. And what Dr. Gates is saying is like when you use it more, the other cells that aren't being used as much start becoming recruited to be used for this. So what he's saying is you start playing the piano and that huge amount of area that is contributing, what is it, that is
controlling or
relegated to your hands, that huge amount is relegated to your hands becomes huger, and other parts of your brain start losing aspects of that because so that's why a pianist can sit there and play Tchaikovsky for 20 minutes, not looking at the notes or anything like that, because this brain is like is doing all this. Okay, and then the person who starts is going like ding 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 like that, exactly. Because his brain's still just learning this stuff. Okay,
that's a good example. That's really perfect.
Okay,
and so then the flip side of it becomes when you injure a limb. Let's say you don't lose a limb like in phantom limb pain, but let's say you hit your arm, and then the pain signals from your arm can actually go up into your parietal lobe and start a remapping process within 1 to 2 days, especially if it's a severe pain. So they're talking about this relative to reflex sympathetic dystrophy. That's a condition where people will injure an arm and then the pain won't go away and there's nothing wrong with the joints of the arm, but they get less blood flow, they get heightened stress responses to the arm, and they see that actually their parietal lobe starts to change. We're seeing basically the same thing with fibromyalgia, which is a major subset of our chronic pain epidemic, to where the brain is remapping itself. And then when the brain remaps itself, especially this parietal lobe, it starts talking to other areas of the brain abnormally. So it starts involving the emotional areas of the brain. And they've done studies where you're not really suffering from pain unless this one part of your frontal lobe called the anterior cingulate cortex lights up. It is your suffering area. And we see in fibromyalgia patients that area lights up incredibly when it shouldn't. And so that's why putting on a shirt can be painful. That's why your husband giving you a hug can be incredibly painful. We just had a fibromyalgia patient yesterday come in. She had finished her program, but she's been doing her maintenance instructions. And I saw her and her fibromyalgia is pretty much gone. It's interesting because it takes time for your brain to unwind from the pain. And yes, the other factors are involved. So some fibromyalgia patients do have mechanical dysfunction in their lower back that may need to be addressed. A lot of fibromyalgia patients, again, their nerves are dying and degenerating in their feet. That has to be addressed. A lot of them have bowel inflammation, has to be addressed. Immune inflammation of the thyroid has to be addressed. They've been through childhood trauma. That has to be addressed. We've talked about all those components in other broadcasts. But in today's broadcast, we really want to hit that your brain is a huge factor in this problem, and no one is talking about it.
Yeah, and if all of those are addressed, and you have these factors that Dr. Gates is talking about, and we've had a presentation on this, an overfiring sympathetic nervous system, when you're in fight, flight all the time, and it's flooding your system with stress hormones, all that other stuff isn't going to work. Not for any length of time, unless you address the what I would argue would be the most important component, which is the brain component.
Okay. Exactly. And so now within our healthcare system, everything is one thing for one problem. So now researchers are trying to use magnetic stimulation over the brain to try and fix this problem. Other people are using laser over the brain to try and get the parietal lobe to remap itself. And while those may be temporarily effective, it just goes back to the same model of you're not correcting this whole vicious cycle of a problem. So what we do is
vicious cycles.
Everything I laid out there from, the childhood trauma patient has to go talk to some form of psychiatrist, hypnotherapist, counselor in our office, to the autoimmune thyroid patient that has to be dealt with. But then we actually have a brain-centered approach with our chronic pain patients where we go in and we do what's termed neuroplasticity-based exercises. You can strengthen your muscles. We now know you can strengthen your brain if you give it the right metabolic environment. And so that's a huge tenet of what we do with chronic pain patients. We've seen some pretty astounding results by doing things to remap this parietal lobe, by doing things to prevent this parietal lobe from talking to other emotional areas of the brain, resynchronizing the parietal lobes with the frontal lobes through specific exercises. And that's how we broach the problem.
Yeah, so the right metabolic environment means this. So you're going to the gym, you're gonna exercise your muscles. All of that Dr. Gates said about remapping and by synchronizing the brain comes through determining which parts of the brain are not functioning right. And if they're not functioning strongly enough, they can be strengthened. The same way you can strengthen a muscle, you can strengthen a neuron, or you can strengthen nerve cells in the specific part of the brain that needs to be strengthened. You can do that much more effectively, actually long-term and short-term, you can do that much more effectively if the metabolic issues are handled. And that means a brain needs proper blood sugar, not too high, not too low. It means enough oxygen, thus the lady's comment on don't smoke or you'll get Alzheimer's. That's not necessarily true, but your smoking destroys oxygen to your brain. You need proper blood sugar, you need proper oxygen, you need proper stimulation. If it's weak, you need more stimulation in that area. And you need a lack of inflammation. And I would say, you need your immune system to be under control, which creates inflammation also. When you get to that lack of inflammation part, now you've opened up a Pandora's box. All that stuff has to be calmed down. So you wouldn't go to maybe some of you do, probably a lot of you do, but most people who are serious about, let's say bodybuilding, wouldn't go to the gym and spend hours fine-tuning their muscles and then go home and do a number of things that would create poor physiology in their muscles, a la not sleep, drink too much, smoke, drink tons of coffee, eat at McDonald's all day long. You wouldn't do that, okay? That goes like about 1,000 times more for your brain cells. It's just so subtle. I mean, I have this, I've had 9 concussions. I do these exercises every day, and it doesn't and so I'm kind of in pretty good shape. Last week, if you watched, you might have noticed I wasn't in very good shape because I was overcoming pneumonia, and that affected physiology, which if you watched last week and you've watched us consistently, you might have noticed I was kind of like not talking very much, not talking very congruently, not talking very coherently. I watched it last week and I just felt like, oh my God. So you have to have that chemistry right. And this is where you can kind of argue that's where the medical model is. The chemistry is basically medications, okay? And again, we're not anti-medicine. We're not medical doctors and we're not anti-medicine, okay? This is where the alternative care group lives. And we're all over that, Okay, we're all over that, except people are still getting sick. People are coming to us. We're wondering like what's going on, and it becomes obvious that the problem is that the brain, which controls everything, and people kind of remember that when I say that. They go like, oh yeah, the brain controls everything. It kind of like when it's not working right, it kind of contributes to pretty much everything that person's probably feeling. If you have this part of your brain isn't working, your frontal lobe, okay? If your frontal lobe isn't working, and this is a general for all you neurology guys out there, okay? So don't start writing me and going, he knows, all right? Then you're gonna be subject to depression. Maybe if it's overfiring for a reason, you're gonna be subject to anxiety. Again, these are gross generalizations. You might be getting another stimulation from outside of your body, maybe a thyroid that's going up and down. Maybe that's contributing to this going up and down. And I'm doing this very simplistically so you can understand. That may cause you to go up and down. And you may get some sort of a diagnosis of bipolar. But you may also, and I think this is important because I think this is where Dr. Gates really started out with. I was a chiropractor first. Okay, and I have always been interested in nutrition, and I have done nutrition, and I stopped doing it in the 80s because it was inconsistent. I don't like inconsistent. I don't like it when it's unreliable. I don't like it when I give a person a diet and this one gets better and this one doesn't. I give a person a supplement. So I stopped doing it. But chiropractically, we would have, I would consider myself a pretty competent chiropractor. We do a good job. We did evaluations. We put together individualized programs. It was always my intent for the person to get well. Why did these 80% of the people get well and these 20% didn't get well? They kept coming in. They would get up. They would go down. They would get worse. Person would come in with a shoulder problem, and we'd be working on their shoulder, and we'd be doing ultrasound on their shoulder, and we'd be doing manipulation on their shoulder. We had massage therapists on staff. We had physical therapists on staff. I mean, we had a neurologist on staff. I mean, we had everybody. And these people would just keep getting worse. So we would, frankly, we would all kind of like write them off. I mean, it was like, okay, maybe they're just psychologically imbalanced, or maybe they needed to, maybe they were in a car accident. Maybe they were, they're now all of a sudden they've developed what today we would call fibromyalgia from a car accident. Maybe they're just looking to get paid, Well, in the end, this was before 1990, probably before 2000. And in 1990 is when really this stuff started being understood. And in the end, when I look back at those patients, they either had a bad cerebellum, that part of your brain that controls that does a lot. You got dizziness, vertigo, balance, or migraines, you better check your cerebellum, okay? But in addition to that, it controls all your spinal posture muscles, neck, mid-back, low back. Here I am pounding on somebody who's going like, man, I'm kind of a little dizzy every time you adjust me. I can't adjust them because their neck's tight. Well, in retrospect, those people got in a car accident, screwed up their cerebellum in their brain, and they were never getting better. And those people are still having that happen today. How do we know? Because they show up here. That person gets hit and they get in a car accident. It changes their life. They get in the stress mode. They start flooding their system with stress hormones. Other things are happening. It's one of the factors that causes them to have fibromyalgia. Maybe they already had a gut problem. Maybe they already had a thyroid problem. And now they have these overwhelming stress mechanisms. This is fibromyalgia. Well, they developed fibromyalgia. I'm sitting there on a stand in a courtroom trying to explain to somebody that I really believe that my patient isn't lying, that they got in a car accident and all of a sudden from a little neck injury, they had pain everywhere. It was this brain mechanism that's not shutting off the pain. And that patient was already set up for having it because they had the thyroid problem and they had the gut problem. Now, I'm trying to bring us down to a practical means. And some of you might be sitting out there who had a car accident and go, holy cow, I've been going to the physical therapist. I've been going to the chiropractor. I've been going to the acupuncturist, and I have deep respect for all of them. But if you're having that happen and it's not getting better, it's because of the complex mechanisms in the brain that Dr. Gates is talking about. And one of the things that's cool about what he was talking about is this whole brain like works together. So if you get like one part of the brain out, like you can maybe go back to like the hands. When you get one part of the brain, it's like start it's like the other part of the brain kind of like has to balance out. So it kind of goes down. So when you start either strengthening this one, or if it's appropriate, calming this one down, you start getting your whole brain to synchronize better. Parts of the brain that really individually need help, if you understand the brain, the way that, not the way I understand it, but the way Dr. Gates understands it, you can evaluate the brain and target specific parts that are affecting your knee pain, from your knee down to your leg. I'm talking a knee pain. You've been everywhere. You've tried everything. It isn't happening. I'm talking about that little girl came in here, was playing soccer. She got a surgery. Mm-hmm. They said they cut her nerve. She ends up with reflex sympathetic dystrophy. You're not going to get her better. She's playing soccer and basketball now. She's in no pain. And the brain was the key. Okay, so I'm trying to bring this down to a level of reality for you. All right, if her brain was in massive stress. All right, she had a massive stress issue going on in her brain, and it was perpetuating this problem. You don't have to really understand the mechanisms of that. All you need to know is that we've had a lot of cases like that were told that they were never going to get better, and they are already, that some of them started improving the first day, once that mechanism in the brain that wasn't filtering out the pain was either engaged or calmed down or whatever it needed to be. And this is, the data out there on this is like voluminous. Let's use the term voluminous. Okay, it's not like there's like a study out there or two on this. There's tons of it, but these things don't respond. If you have stress mechanism going on and your brain's firing like crazy, that's deep in the middle of your brain. But the medicine that's being used is out here trying to affect you in a part of the brain that's shutting things down, but it's not fixing the problem in there. So what I'm saying is these mechanisms that Dr. Gates is talking about are not being, they're not going to be addressed with the models of care that are out there now. I'm a chiropractor. I'm all over chiropractic. We're all chiropractors here. We all have chiropractic backgrounds. We have chiropractic, but you can adjust somebody's neck or shoulder or elbow or knee from now till doomsday. And if this brain mechanism is engaged, it is not getting better. I can tell you, I've had it. Have I had patients who ultimately came in before I was really conversing with all this stuff and had fibromyalgia, and I adjusted their neck? Simple problems, simple whiplash, and I watched them get worse and watch pain spread all over their body because I had no clue what was going on. Oh yeah, I had that happen. I had that happen a lot, and it was confusing. And you start putting ultrasound on it, and then you start going over here, and then you start taking Valerian root, and then you go to the acupuncturist, and that's not working, and nothing's working. People, if nothing's working, you at least need to understand these mechanisms of the brain. I will tell you, I do these consults, and maybe it's because everybody says, oh, everybody's always teasing me because I'm from New Jersey, but I mean, sometimes you just got to tell it like it is. If you have any chronic pain out there, I mean, if you have, like, I'm telling you, if you have migraine, dizziness, vertigo, balance, if you have restless leg syndrome, if you have a gut that's not getting better, if you have almost anything that's not getting better, I'm going to tell you, this brain is probably, it is very probably, maybe not 100% of the time, but close. It is probably the reason, because you got to understand something. Your body's trying to get better all the time. Why is it that you cut your finger and it's getting better? Why is it that you break your bone and it's getting better? But this chronic pain thing is blowing up to 130 million chronic pain things in the country. Oh, it can't be fixed. It's something we don't know about. It's something, maybe it's the Zika virus, or whatever it is now that's coming out. It's not that. Okay, your body is, for the most part, designed to do this. And and in our evolution of marrying our two disciplines, I don't know if you remember, but I actually started out with the brain.
I know.
I actually started out with the brain for about 8 or 9 months. I never got to anywhere near the stage of being a certified functional neurologist, functional chiropractic neurologist. But I was kind of like, like getting results just doing the brain. And they were big results at the time. The first person I treated had miraculous results. Fibromyalgia was disappearing, but then ultimately we married the two and we started to see, oh, the gut. You've heard us talk about the gut a little bit. Well, the gut screws up all the chemistry where? In the brain. Okay, it's really not the chemistry that's screwing up around here. It's really the chemistry that is screwing up in here a lot of the time. And so as we've seen this, Dr. Gates has been refining this more and more and more. We were just talking about this the other day. I don't mind saying that we're starting to see a lot of depression now. We're starting to see a lot of anxiety. We're starting to see a lot of things. And we've seen those with all of the patients coming in here. I mean, everybody comes in here is depressed. Everybody. I mean, they're depressed. They don't know what's wrong with them. They don't know. People think that they're crazy. They don't know if they're ever going to get better. Plus, their frontal lobe isn't working right. Mm-hmm. If your frontal lobe isn't working right, you're going to be probably depressed. And then as we treat them for fibromyalgia, and as we treat them for peripheral neuropathy is pain, numbness, and burning in your feet. Why would you treat that and have their depression go away? Okay, because we're treating the brain. Okay, and so I'm bringing that down to just general levels. So you understand, what he's talking about is that there's mechanics. Dr. Gates is sharing the mechanics with you. I'm just kind of sharing with you what I've had the privilege to be part of, observing over a period of time, and we've morphed really. It's important enough we're talking about this because really over the last year and a half, we have really morphed into, you walk in here, you're getting your brain treated. You're not, I think I have a patient who's going to come in here in this next week and want us to do just that might work out because that person may just want us to do the brain part. But what we have found is if we do both, it's better. But if you come in here and say, no, I just want the nutritional part, we're not treating you. Mm-hmm. We will not treat you because we have seen that you have to find out the component of the brain, the nervous system, if you want any long-term response, and that's what we want, okay? We're not looking for short-term. If you want long-term response, you're gonna have to find someone who knows how to work with your brain and again, right, the only term that's available to me right now, in a functional manner. They're gonna be able to look at your brain, and here's the other thing, okay, because this is the thing that people get kind of confused on. We're not talking about pathology. A lot of you are sitting there going, well, I went to the doctor and I got a CAT scan and I got an MRI, so my brain's normal, so you guys are like, full of crap. All right, no, we're not, okay? We're talking about brains we're talking about people that went to the doctor and their EEG is normal, and their CAT scan's normal, and their MRI is normal, and then we do a neurological exam on them, and we have them close their eyes, put their feet together, and they fall to the ground. For the record, that's a bad cerebellum in a person who has a perfect MRI. Okay, so these are functional abnormalities we're talking about. We're talking about a brain that got whacked, talking about the concussion thing that's going on now, and they can't diagnose chronic traumatic encephalopathy, CTE, the professional football, until you're dead and they start slicing you open. Well, you can diagnose the effect of that or how that's functioning, causing the brain to poorly function today. You can absolutely do it. He can do it. I can't do it anymore. But
that's the thing. Through a thorough neurological exam, we can really tease out which part of your brains are functioning well, which are not. If you have abnormal processing in your brain of these painful stimuli, we can really delineate all of that. So that's kind of what we wanted to highlight with this chronic
that's
pain
what you're
broadcast.
Really talking
exactly.
About.
And that's what we wanted to highlight. Yes, the metabolic features are important. You can go to all of our other broadcasts on powerhealthtalk.com and watch those. But you got to get that the brain is a piece of the puzzle. So I think that's pretty much everything I wanted to say. Do you have anything else?
Nope. I think you just told me I was saying too much. So I'm done.
So we'll have another interesting broadcast for next week.
Okay.